vaccine clinics for teens opened this weekend, even as some groups try to spread misinformation to parents about safety and efficacy. Here to answer your questions is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Good to see you.
It's good to see you too, Emily.
We've seen these protests already in some school districts, and now they say they plan to target vaccination clinics like the one at the Museum of Science this weekend. What is your message to parents who may read these posters and think, am I doing the right thing for my child?
I would really encourage parents to remember that unlike social media, unlike the majority of websites, websites such as the CDC are obligated to report scientific, validated information and to use that to back their recommendations. The same is true of organizations like the World Health Organization and the American Academy of Pediatrics. So I would encourage those parents to really think about where they're getting their information from and really rely on sources of information that they know can be trusted for delivering scientifically validated information. And there is unfortunately a lot of misinformation and non-validated and non-vetted information out there to tease through.
I want to ask you about some of the claims that they're making. The first one, are these COVID vaccines experimental and unproven?
These COVID vaccines are neither experimental nor unproven. These vaccines only were authorized after each of them were rigorously evaluated in large clinical trials for safety first, and then for their efficacy at being able to prevent COVID-19 infection. They all exceeded the scientific criteria for being able to prevent COVID-19 infection. And now, even beyond these clinical trials, we have the in real life data now that over 1.8 billion COVID-19 vaccine doses have been administered. We have excellent data from countries that have been able to vaccinate the majority of their population, that these vaccines not only prevent COVID-19 infection and spread, they prevent hospitalization and death from COVID-19, and they are moving those countries towards getting this pandemic under control.
Here is another one that we've seen. Do young adults suffer from heart issues after vaccination?
It's important to understand the context behind this, and that really starts with some numbers. So there are 2 million 12 to 17-year-olds now here in the U.S. that have completed the 2-dose Pfizer series, and there are 8.5 million 18 to 24-year-old young adults who've completed a COVID vaccine series. So of those over 10 million people, the CDC is carefully investigating a very small number of reports of myocarditis, which is inflammation of the heart muscle, that have occurred in some of these individuals who've been recently vaccinated. But it's not yet clear if that heart inflammation is due to the vaccine or not. It's important to understand that many illnesses, many viral infections, many non-infectious things can cause inflammation of the heart. And we know that COVID-19 infection and the inflammatory condition called MIS-C that can follow a COVID-19 infection can indeed damage the heart. So it remains true that the risk of getting sick from COVID-19 infection is much higher than the risk of getting a serious side effect or adverse event from a COVID-19 vaccine.
And this is why we come to you every week to help us get the facts. Dr. Moffatt, thank you so much for your time. We appreciate it.
Sure. Thanks for having me.
Good